All right, growing pain. Well, really, there's no consensus on the definitions. We know that they're recurrent, they're self-limiting, usually involve the extremities, most notably the lower extremities, and they should be bilateral. It's interesting because we know that growing pains don't coincide with periods of rapid growth, and they don't occur at the growth plates. There is some thought that maybe they could be related to bone density because of the speed of sound through bone, or mechanical factors like overuse or hypermobility. There's also been some thought that maybe this is occurring more in children who have lower pain thresholds, because children with growing pains are more likely to have migraines and abdominal pain. Would vitamin D supplementation help? Studies have shown that growing pains can occur in about 57% of children who are vitamin D deficient, or as high as 94% of children. But both of these studies did not take into account control or placebo groups for comparison. The differential for leg pain can be so broad. So I'm your doctor. How will I know if this is growing pains or not? Well, again, it's going to be something in the lower extremities. It's going to be bilateral. Usually they occur at night. Usually you're going to have symptom-free periods, and then they'll occur again. Should not be associated with things like weight loss, fever. They should not coincide with any kind of joint pain. Not see any swelling, warmth, redness at the joints. They should not be tender to palpation. But let's say I'm not really clear. Maybe I'm still worried. I could do some labs, and usually the labs are very normal. There's no signs of inflammation. What can you do for growing pains? Massage, heat, anti-inflammatories like Tylenol or Motrin could maybe help. There is a study that shows that stretching consistently before nighttime can also help. So these are the typical stretches that we would recommend. I'll be really honest, the studies are unclear if the stretching actually helped, or was it just the extra attention from a caregiver. I'll tell you something really funny. My mom's a pediatrician, and whenever I would complain about growing pains, she used to tell me, drink some milk. And I just assumed she meant that time your legs hurt, it was a PRN, chug the milk, and it's supposed to make it better. So I remember going downstairs in the middle of the night, drinking milk, and then going back upstairs and wondering why it wasn't getting better.